I mean, they usually have other issues that without wasting the patient's time, need to be pre-treated. Like I'll do a lot of pulse dye, so I get less bleeding. So somebody like you that has a reddish tinge, we'll use vascular laser.
Do you do any IPL?
Well, I use the pulse dye, but you can use IPL
well, yeah,
too.
I just wondered if you use IPL.
No, I don't use IPL. I only use laser. But you can use IPL. I mean, I like the fact, the pulse dye laser. And then you do the pigmentary issues with the appropriate pigmentary lasers. You can use an IPL. I use a Q-switch.
May I ask what topical concoction you prefer?
Well, the best concoction was when it was taken off the market, Triluma. But I mean, they have equivalents.
There's another one out that's equivalent, that's even better than Triluma. I've got the name of it over here, I can tell you.
But it's not manufactured. It is manufactured?
Yeah, I got the name of it. They did a side-by-side comparison and it beat Triluma.
So,
and it was less irritating.
But it's not the same chemical formulation.
No, it's different. It's a triple.
It's a triple formula, but not. So I use a compound triple formula now, which I think is superior to the Triluma that was available. Although the Triluma is consistent and it was packed, it's like your machine, so it was just packaged properly and it was just consistent all across and easy to use.
And you go, 5-6 weeks or a month or?
Well,
pre-treatment?
I mean, somebody like you, maybe one week. It could be as early as 1 week.
Right.
Somebody like me, 2 weeks. Him maybe 3 weeks, 4 weeks, and then let's say your Mid-Eastern patients, Asian patients longer, and African Americans longer. But sometimes with the proper prep, I'll start doing what I usually do is when I start them with the non-ablative lasers, I usually do a little test batch because not everybody pigments. So she'll say she had even the woman from Iran that was complaining. It's not 100%, maybe 50%. I mean, it's actually a very vocal 20% probably. But I mean, so the patients that don't have any problems, you don't see. They just have a treatment and they go home. They don't want to even come back. They come back in a year for another treatment. So many patients won't. So I usually, as I'm treating, first of all, to show the patient what it looks like, and to already get them used to doing the post-op care appropriately.
Do you stop on a week before to let the skin calm down? Because sometimes the topicals are a little bit irritating.
No,
their skin's a little bit
actually the
inflamed, irritated.
When they're retinized, the ones who are most irritated do the best. You can't get post-inflammatory hyperpigmentation with increased epidermal turnover. That means if you use just plain retinoic acid to the max, or tazarotene, which is even more potent, and just peel the skin, you actually have less of a chance of getting post-inflammatory hyperpigmentation. Just like if you treat some active erythematous areas, there's less chance of it. So no. So I actually have them overdo it. 2 or 3 days before I do the fractional, I have them use it twice a day. I said just get red and irritated.
That's weird because I've read where a lot of people, they say if the skin's irritated, they're more likely to get PIH because the skin being irritated is more prone to injury and to hyperpigment, so they back off a week.
He's probably going to want to take me off, but that's because many of your cousins